Chairman, and thank you, Mr. Secretary. I'm Mark Pocan. I represent the 2nd Congressional District in Wisconsin. All are part of 6 counties in south central Wisconsin. I don't know you, and I think it's important to have a good working relationship with you because of everything that you have. There's a lot of jurisdiction. You've definitely got your hands full with a lot. Some things I think we agree on, and some things I'm not sure if we do. So I'm really trying to explore a little bit of that. I think some things that we agree on, and you brought it up, you want to have a special focus on chronic disease, correct?
Yes.
Yeah, great. And one that maybe Chuck and I disagree a little bit on, but I support what you're doing on ultra-processed foods, on food dyes and other junk chemicals, and promoting healthier diets. That's another focus, correct?
Yes.
And also, I think you're supporting and making it easier to access non-pharmaceutical, in other words, natural remedies as part of a person's healthcare decision.
Yes.
And one I didn't have on the list, but I heard you tell Mr. Simpson on dental care. I have a constituent who, because of a infection with a tooth, is now getting Meals on Wheels and his health is destroyed. So I appreciate that as well.
Yes.
So in trying to get to know you, there's some public things that make you somewhat of a conundrum to people like me, just trying to understand. One is on vaccines, and I don't want to ask you about all the specific theories on vaccines, but something that might be helpful is you've previously said you vaccinated your children. Just because I think this is a helpful answer, and this isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make
but that's kind of your jurisdiction because CDC does give advice, right? I'm not trying to do it as a gotcha. I was just kind of.
I think what we're going to try to do is to lay out the pros and cons, the risks and benefits accurately as we understand them with replicable studies.
Can you talk about chickenpox? Would you vaccinate your child against chickenpox?
I don't want to give advice. I can tell you in Europe they don't use the chickenpox vaccine specifically because the preclinical trial shows that when you inoculate the population for chickenpox, you get shingles in older people, which is more dangerous.
Just one last one, just a yes or no, please, if we could. Polio?
Polio? Again, I don't want to be giving advice.
That's fair. No, that's fair. Like I said, I was not doing it as a gotcha. I thought it could be helpful if. Okay, so let me ask this on the 988 hotline. In your budget, you have eliminated, there was a special button you could press for LGBTQ plus youth. I'm an openly gay man. I deal with a lot of organizations that deal with this. The suicide rate among LGBT youth is 4 times nationally the rate of other youth. This is one where I hope that we could try to, like Chuck asked, work together to try to see if we could have a conversation about not eliminating this because, unfortunately, because of the bullying that's out there, because of, honestly, adults bullying, both in Congress and state legislators, these kids are often at unique risk, and having that specific button they can push helps them to be able to get that service. Is that something we could talk about, at least trying to?
I'm happy to talk to you about it, and I love the way that you approach this in a way that, rather than attacking me, is, reaching out. And I'd love that from other Democrats because I think we have a lot to talk about. As you know, and I like that you
just because I am short on time.
The 988 line is, was created by President Trump. He believes strongly in it. The reason he removed that button is because we don't want to isolate different demographics and polarize our country. Everybody on that line is trained in cultural sensitivities.
Sure. I gotcha. I just would love to talk to you because I think this is a unique one, and I respect that we can
I'm
have a
happy to
conversation.
talk to you. You can pick up
Last
the
one,
phone.
just because I'm down to 22 seconds, I lost a little time
Okay.
there. Medicare Advantage. I know the Trump administration is going after waste, fraud, and abuse. This is a program we get a lot of constituent complaints on. It costs more than Medicare. It was intended to find savings. It doesn't. In fact, I think the current estimate is $80 billion in overpayments have gone to private insurers. Are you committed to, one, going after those overpayments, and two, if Medicare Advantage isn't more cost effective, would we have a conversation about either eliminating the program or making it more effective?
Medicare Advantage, I mean, I definitely want to go after the waste, fraud, and abuse in the private sector. There's 30 million people who want Medicare Advantage. I have Medicare Advantage. It works very well for me. I like it.
But it costs more, and that's the point. It does.
I mean, I think our administrative costs are still far less than private industry.
But it costs more than Medicare, and that's my point. So that's all I was trying to
But the services are much better.
Okay. Another thing, if we can talk about and continue
Okay, well,
conversation.
why
I
don't
am
we talk
sincere about
about it?
having a working
I'm happy to
relationship
talk to
with
you
you,
about
Mr.
it.
Secretary. Thank
Thanks.
you. Appreciate it.
Ms. Bice.